But one of the common refrains which we get is, I've got myself double vaccinated and still I've got COVID. So why is my vaccination not keeping me safe from Omicron? Any light on that?
Yeah, Sunil, the fact that he's still alive to say such a thing goes to prove the fact that the vaccine worked.
I like
Uh,
that.
American hospitals are filled with, ICUs are filled with people. The majority, more than 80% of the people in ICU with COVID are people who are unvaccinated. So
Oh,
let's
right.
go back a bit and let's just revise this vaccine fiasco of ours. Vaccines do not prevent us from getting the disease. That's the first point. What prevents us from getting the disease? The good old mask, which I had harped about a lot last time, and I wouldn't mind going about it again today, because that's the only thing which is going to help us. So no amount of supplements, vitamin supplements or zinc supplements or vitamin C supplements is not going to prevent you or me getting the disease. No amount or no number of vaccine or the boosters which we have so far have shown to prevent us getting the disease. No amount of medication can prevent us from getting the disease. The only thing which can prevent us from getting the disease is one, not coming in contact with anyone with the disease, which basically means that you have to have a low threshold for testing, because most of the spread is in the asymptomatic or in the early stages. And two, uh, using your mask properly, basically.
Mm.
The other third one
Coming
would be
back.
okay, avoiding crowded places, but that goes back to the first point, where you stay away
Mm.
from close contacts with people. So the closer you are to anyone else, and if you are spending quite a few minutes with them, the greater the chance that if the other person is positive, you will get it. Not
Makes sense.
if you are wearing a mask, though. The mask should be a
Correct.
proper mask to be worn properly.
Fair enough. So, booster shots are now available for 60 plus the vulnerable people and the frontline workers. So, is there a correlation between the booster shot and your chances of not getting Omicron or getting a milder attack of it?
See, there's no vaccine which has been specifically manufactured for Omicron yet. So that's the first point. Second point, with the booster, as I've mentioned, will not prevent you from getting the disease.
Mm.
Yeah, if you are not careful, you will get the disease. Let's be
Mm.
very clear about that. That is, as all the vaccines which we have been using for the last year or so, and the data we have and the evidence we have clearly points and shows that the efficacy of the present vaccines against Omicron is lower. So it was higher against the Delta rather than the Omicron. So one, these vaccines are less efficacious against Omicron. Two, vaccines will not prevent you a disease, as in it will not help you stop the disease from coming into you or getting into your system. But what it does is it decreases the severity of the disease, which basically implies that your oxygen will not go down as it used to before. You will not land up very sick. Even the duration of the disease, which I'm seeing on a daily basis, is much less than the previous ones. In fact, the follow-up I've decreased from 10 days, which I used to do with my
Mm.
Delta variant patients, down to 7 days, because most of them are
Okay.
getting well within 2 to 4 days. So you have a fever, it comes
Mm.
down, you might or might not get it again. And then you are right as rain by the third or fourth day, which is not what we
Okay.
saw early on. Early on, it was a
Right.
struggle. This time, it's much easier. But at the same time, as I had mentioned earlier, people are getting admitted. These are the people with comorbidities who are
Mm.
old, above 60,
Mm.
65, who are diabetic, who've got kidney disease, who've got lung disease, uh, chronic bronchitis. These are people who are on steroids for whatever reason.
Mm.
These are people who've been cancer survivors and are on immunosuppressants. So yes, the vaccine does decrease the intensity with which the virus attacks your body and makes you sick, but it does not stop you from getting it. You're the only one who can stop yourself from getting it. And at the same time, boosters will increase the antibody levels to the virus. But these are not specific for Omicron because we don't have any such vaccine yet. My guess is going forward, as is true with the influenza vaccine, where every year WHO recommends a specific vaccine which we give to our susceptible patients, and every year it's a new variant. So the vaccine is against that particular variant prevalent the previous year. And my guess is going forward, that is essentially what's going to happen.
Got it. Got it. One practical question, doctor. Uh, Earlier, I remember, even though we used to have patients who completed their 14 days and were absolutely fine, um, they kept on testing positive day after day. And in fact, I had a colleague who tested positive for a month and a half, and the office did not allow him to come in, saying ki unless you get a negative RT-PCR, you won't be allowed to come in. So can you burst the myths around that particular fact?
The medical evidence, as far as being RTR positive is concerned, uh, is that beyond day 10, the chances of the patient being infectious is very low. It's less than 5%. So it's not zero, but it's less than 5%. So the chances of
Okay.
you getting it from a patient on day 0 or day 1 or day 2, and from the same patient on day, let's say 11 or 12 or 13 or 14, is about 100th or 1000th the probability or the chance. That's the first point. The second point is, we do know that some people carry the virus in the nasopharynx or the oropharynx for weeks or even months. There was a hypothesis, and it's been proven that most of the viruses we tend to pick up during that time are dead virion. So these are not viruses which are alive and which can infect people. So there are two sides to a coin. One, you can have live viruses, but the amount is so small that the chances of you getting infected is very low. That's the first point. Second is, even if you do pick it up on the RT-PCR, it's very difficult or next to impossible to differentiate on a general lab basis whether it's a live virus which can infect someone else, i.e. others in the office, or whether it's a dead virus, so it's of no clinical significance at all. That is the reason behind WHO even last year, early last year, saying that you don't need to get a second RT-PCR tested. And that is essentially what I've been telling everyone for the last, all my patients for the last 1 year, that you do not need to get tested after day 10, unless, of course, your office, your employer, your housing complex, or whoever has specifically asked for a negative RT-PCR, in which case you have to follow rules. I remember a specific
Mm.
incident where this
Mm.
was very sad, and I'm mentioning it just to make a point. Uh, this was a family I was looking after last year, where unfortunately the father died. He was admitted, he couldn't make it, and the mom had it, and the son, who was my patient, had it. Now, by day 10, mom was all right, and she wanted to go to the religious ceremony uh, for her husband. Now, she had asked me, do I require an RT-PCR? I said no. Now, what happens is not everyone trusts their own doctors. And I can understand that this is a real chaotic times. You'll have 10 different people
Mm.
telling you 10 different things, including doctors, hospitals. WHO says one thing, FDA says another thing, CDC says yet another thing, ICMR says another thing, and even doctors are confused. So I don't blame her when she got herself tested. Now, unfortunately, it turned out to be positive again. Then she got stuck. Because if she had not tested, she could have gone for the ceremony. But now that she had tested and she had turned out to be positive, she couldn't. And that was really sad. Not only did she not be able to do the last rites or be there for her husband when he passed away, she could not even do the other ceremonies involved post his death. So this is
Yeah,
just
yeah.
one exceptional example of what can happen or what might happen. As I said, if there are specific indications for doing it, as in the office wants you, then that's a separate story. Why the office
Mhm.
wants you is beyond me as far as my medical information and data is concerned. But if the office or your employer wants it, separate story. If nobody wants it, don't test.
Okay. I think that's as clear as one can get. I get Omicron, right? And I become okay. Now, it's early days, I know, but what is the present reckoning of the aftermath of this variant on our body? Is there anything which we know about that, or it's too early just now?
I think it's too early. What I have noticed this time, and which what my colleagues concur with, is the fact that most of the symptoms are in the throat. So nearly all my patients have sore throat, painful throats, coughing, uh, along with the fever. Unlike previous occasions where most of the times the lungs were affected, and that was proven on CT scans. This time, since see, even the last time I never did any CT scans to routinely to see if the lungs have been affected, because that would not change the management. You do tests where you think that the result of the test is going to change your management of the patient. That is the indication for testing. That is one indication for a medical test. The second indication for a medical test would be to rule out a particular disease. So we do routine medical health checkups for the latter group. So I want to make sure I don't have diabetes. So I check my blood sugar once a year, for example, or my cholesterol once a year, or whatever, depending on the age group you're under. Now, what's happened during this the corona epidemic is if your oxygen saturation's been okay, it basically means that your lungs are not that compromised. If your lungs are not that compromised, you do not need a CT scan to tell you that your lungs are not compromised. The most sensitive way to find out if your lungs are compromised is your oxygen saturation, which you can sit at home and monitor. So that's the
Right,
most crucial thing to monitor. Once the oxygen saturation goes down, only then would you think of getting a CT scan done.
right.
Unfortunately or fortunately, I would say fortunately, none of or minimal of my patients this time around uh, have had a fall in saturation. Now, you have to remember that most of my patients are patients with severe disability as far as the lungs are concerned. So
Mm,
most of them would already have low oxygen saturation due to whatever disease.
mm,
So that is the baseline parameter as far as my patients are concerned. So for example, now people know that if the oxygen falls below 95, you should get a CT done or get oxygen at home, etc., etc. But the problem with my patients is that they roam around on a day-to-day basis with an oxygen saturation of 90, 91, 92, 93, depending on the severity of their underlying lung disease. Okay. So
right,
here
right.
what we do is if there is a fall of 4 to 5 points as far as the saturation is concerned, that would be an indication for a CT scan.
Mm,
So their baseline, unlike yours or mine, which would be about 98, 99, 100, their baseline is
mm.
91, 92, 93. So from there,
Correct,
it has to
right.
fall by 5 points
Mm,
before we think of a CT scan. Fortunately, none
yeah.
of my patients have had it. And as a result, we are completely blinded. And I don't recall, unlike the first and second waves, when lots and lots of CT scans were done for medical research, I don't
Mhm.
recall any such series of patients being published just for the Omicron variant. As a result, we are
Okay.
right now blinded, and my best guess would be it's not affecting the lungs, and so for the lungs would be relatively spared. As far as the other
Okay.
effects of COVID is concerned on the body, I think it's just too early to
Mm-hmm.
say whether it's going to affect or how much it's going to affect the heart, the kidneys, excuse me, the
Right.
liver, etc., etc. The general tiredness, the brain fogging we used to see with the in
Mm-hmm.
the second wave with the Delta variant, how these symptoms are going to affect our Omicron patients, only time will say. It's too early.